clinical officers have threatened to down their tools, citing neglect by the government in the fight against the COVID-19. And now this comes as 10 senior doctors succumbed to the virus since the first COVID-19 was reported in the country in March this year. Musa Salah with the details.
The Kenya Union of Clinical Officers has urged the government to allow its members who are vulnerable to COVID-19 not to report to work, further saying that most of its members who have succumbed to the virus were in the vulnerable groups such as expectant mothers, the elderly and those with underlying conditions.
We have come out as Kenya Union of Clinical Officers calling on the government to exempt the vulnerable group within the healthcare workers.
Speaking at a press conference in Nairobi, the union's chairperson Peterson Wachira accused the government of neglecting healthcare providers. The health workers have issued a 7-day ultimatum to the government to meet their demands or risk disrupting health services in all hospitals across the country.
Our colleagues continue dying without us doing anything. And so we will be demanding that certain measures are put in place within the next 7 days, failure of which we are going to issue a nationwide strike.
Meanwhile, the Kenya Medical Practitioners Pharmacist and Dentist Union KMPDU says 10 senior doctors have succumbed to the virus since the first COVID-19 case was reported in the country. Some of the doctors who've succumbed to the virus include Dr. Adisa Lugaliki, Dr. Ndambuki Mboloi, Dr. Daniel Alushula, Dr. Vladimir Ashokin, and Dr. Hudson Inyangala. KMPDU has also issued a 21-day strike notice to the government, demanding that the government supplies all hospitals with PPEs, provide medical cover for all doctors in the country, a further workman's compensation for all healthcare providers, and the employment of 2,000 unemployed doctors. The union also wants the enhancement of the existing risk allowance, dedicated healthcare facilities for healthcare workers in all the 47 counties, and the formation of a constitutional health service commission.
The National Advisory Council of KMPDU, comprising of all top branch leaders of the regions in the entire Republic of Kenya, have today resolved to issue a 21-day strike notice to the government of Kenya.
The doctors have also blamed politicians for continuing with their public rallies despite the rising COVID-19 infections. However, Deputy President William Ruto, who has been fond of holding public engagements every weekend, has said the wave of COVID-19 is clearly ravaging our nation. We should stop everything and mobilize every human, material and financial resources to fight it. End of quote. Until recently, the Deputy President and his allies have been holding political rallies over the weekend. Meanwhile, the country's total caseload has surpassed the 70,000 mark. The total number of confirmed COVID-19 cases in the country now stands at 70,245 after 972 people were reported to have contracted the virus in the last 24 hours. 352 more people have recovered as 20 succumbed to the virus. Health Cabinet Secretary Mutahi Kagwe has called for a special meeting with the National Emergency Response Committee on Monday to discuss the surge in positive cases and review the current containment measures. Musa Salah, TV 47.